All right, today we're diving into a rare genetic disorder called hereditary hemorrhagic telangiectasia. You might also hear it called HHT. It's a condition that affects blood vessels, and we're going to break down exactly what that means. So to really wrap our heads around this condition, we have to start with this question. What happens when the body's smallest, most delicate blood vessels don't form the way they're supposed to? That's really the heart of the issue we're exploring today.
Okay, so first things first. Let's start at the very beginning, with the root cause. What is actually going on that leads to this condition?
So at its core, HHT is a rare condition that you inherit. All the signs and symptoms, they're caused by the dilatation or, the widening of what are called terminal blood vessels. Just think of these as the absolute tiniest vessels, the ones at the very end of the line, located right near the surface of your skin and mucous membranes.
And because it's hereditary, it all comes down to the genes. HHT is passed down in what's known as an autosomal dominant pattern. Now that might sound a little complex, but all it really means is you only need to get the gene from one parent to have the condition. And that, of course, has a big impact on families.
So we know the why from a genetic point of view, but what does this actually look like? How does it show up in the body? Let's get into the clinical features.
And wow, this picture really says it all. This is the hallmark sign we're talking about. What you're looking at here are all those little red spots on the tongue. Those are the telangiectatic areas, those wide-end dilated blood vessels we were just talking about. And these little spots, they don't just show up on the tongue. You can find them on the skin and all throughout the inside of the mouth. They usually appear pretty early in life, and they tend to stick around, right into adulthood. Now, the main issue is that these little spots can bleed, and often. When they happen to be inside the nose, they lead to what doctors call epistaxis. But to you and me, that's just a nosebleed.
And actually, those frequent nosebleeds are often the very first thing that makes someone think, maybe something's going on here. It's a key presenting feature and a major clue for doctors trying to figure out what's happening.
So that brings up a really important question, right? If you have these lesions that are constantly bleeding from your mouth, from your nose, what's the cumulative long-term effect on your body?
Well, the answer is pretty straightforward, but it's serious. All that prolonged and recurrent blood loss can directly lead to anemia. The body just can't keep up with making new red blood cells, and that becomes a pretty significant secondary problem. Okay, so now we understand the cause and the symptoms. How do doctors actually go about confirming a diagnosis of HHT? The diagnosis really comes down to two key pieces of the puzzle. First up are the clinical findings, what the doctor can actually see and hear. They'll be looking for those characteristic lesions and asking about any history of recurrent bleeding. The second part, which is just as crucial, is the family history. Does anyone else in the family have similar spots or a history of frequent, unexplained bleeding?
All right, so once a diagnosis is confirmed, what's next on the journey? Let's talk about management and how the symptoms are actually addressed.
And right away, it's important to note that there's no single one-size-fits-all approach here. The treatment is totally tailored to the individual, and it really all depends on how severe and how frequent their bleeding episodes are. So when someone is having an active, acute bleeding episode, doctors have a few direct interventions in their toolkit. They might use surgery to get right to the source of the bleeding. They could also use cautery, which basically uses heat to seal off those leaky vessels. Or another option is cryotherapy, which does a similar thing but uses freezing to stop the bleeding.
And that really brings us full circle to a final, and I think, crucial thought. For a rare condition like HHT, understanding this whole journey, from the genetic cause to the symptoms, all the way to how it's managed, is so incredibly important. It's not just about having information, it's about empowerment for both patients and their families. Thanks so much for joining me for this explainer.